A very good evening, ladies and gentlemen, to everyone who's joined us from various parts of the globe. My name is Ruben Lobo, and on behalf of Team DentistChannel.Online, I warmly invite you to the 9th day from the biggest virtual implantology event of 2020, the world's first virtual Implant-Expo organized by DentistChannel.Online. Ladies and gentlemen, I hope you all have been doing well and you're keeping safe in these unprecedented times of the COVID-19 pandemic. Ladies and gentlemen, up next we have with us a very special speaker, the multi-talented, the very dynamic, of course, the personality you would definitely not want to miss when it comes to oral implantology. Yes, ladies and gentlemen, I'm talking about the very budding, the very charming, and of course, the very talented Dr. Saurabh Gupta. A short introduction about Dr. Saurabh Gupta. Dr. Saurabh is a graduate from the Manipal University, India, and holds a master's degree in oral and maxillofacial surgery from Bangalore, India. He is also trained in multiple allied surgical disciplines such as implantology, laser and digital dentistry. Currently, he is working as a clinical director, Digital Dental Design Clinic at DVG's lab, which is 3M authorized. The same is based in Bangalore, India. He is also visiting senior consultant at the Arogya Dental and Maxillofacial Center, Delhi, India. He lectures nationally and internationally. He is the education director, a board member of the International Academy of Ceramic Implantology, which is the first academy in the USA dedicated to metal-free implantology. He is an active member of the Zirconia Implant Research Group, whose objectives are to lead and orient research in metal-free implantology and support young and established clinicians in the clinical and scientific research. He is also serving the Bioceramic Division of the American Ceramic Society based in Ohio, US. He is involved in research and development projects as an academic collaborator at the Indian Institute of Sciences, the prestigious university in Bangalore, India. He is also a fellow and the ambassador of Clean Implant Foundation, whose mission is to access production quality and cleanliness of commercially available implant surface. He is the advisory board of the Journal of Oral Ceramic Implantology. Apart from this, he is also the clinical specialist at Koho Biotechnology, Taiwan. At present, he is involved in a lot of research studies on dental implant materials and digital dentistry. Ladies and gentlemen, presenting to you Dr. Saurabh Gupta live.
Thank you, Ruben, for the wonderful introduction. And it's a great pleasure and honor to be here. And today I'll be sharing more about zirconia implants and more about the biomechanical properties and how we can push it into our clinical practice in our day-to-day practice. And you will see a lot of research papers and the current studies which are going, and the future, what else is the future along with the zirconia implants. So let's start the presentation. So let me just share and we can have more about the zirconia implants. So can you, Ruben, can you see the screen, full screen now?
I unfortunately cannot see the full screen, so we are facing the same issue. Mr. Siddiq, can you please help?
You can escape it, and there is small note option. There is a comments and notes.
Okay.
Visible. Yeah.
Oh, okay.
Yeah, now we can.
All right. Is it fine now?
Yes, please.
Can you see it now?
Yes.
No, sir. Unfortunately, the same thing is happening.
Yes, please. Once again,
All right, ladies and gentlemen, while our technical team is fixing this, it's not a glitch as such, it's a short notes thing that is coming up in the presentation. I would love to see and hear from you, from which part of the globe you're joining us from. If you're joining us from India, tell us that you're joining from India. If you're joining us from any other country, from the Middle East, from Europe, from Latin America, from the USA, tell us in the chat box, and we would love to have this short introductory session while we are working on the presentation. Once again, thank you, ladies and gentlemen, for joining this session. Please stay tuned. We have a lot in store for you. We have the very special speaker, Dr. Saurabh Gupta himself, who's going to enlighten you with a lot of information and with the kind of research he's been doing. I must say he's been doing a lot of research and he's coming up with something that is definitely going to be one of the aspects of implant dentistry in future. So stay tuned, and we hope to hear from you as well. So tell us from which part of India or which part of the globe you are joining us from. Thank you.
Yes, sir.
All
Please
right,
continue.
there we
Okay.
go. Over to you, Dr. Saurabh.
Okay, so hello friends. Today my topic is on zirconia implants, and I'll be talking more about the biomechanical properties, and then definitely the clinical properties, and we'll be showing some more cases with a follow up, with a good follow up, as well as we'll tell you more and more about it, and then we can have a question and answer round after that. So coming on to the next slide, this is my workplace, the second home. It's White's Dental, located in Bangalore. And then before starting the presentation, I would like to discuss one survey. This survey was done in 2013 and was done in the parts of Switzerland and Germany, and there were around 300 participants, like the patients for the participants. And out of 300 patients, these were definitely the patients who wanted to go for the implants. So they were asked about the preferred dental material for their implant treatment. So you will be surprised to know that out of these 300 patients, almost 50% of the patient, they said they want to go with the dentist, and definitely yes, they will go for the dentist as at the first choice. But you'll be surprised to see that 35% of the patient, they said they want to go with ceramics, they want to go with something white, and only 10% of them, they said they want to go with titanium or metal implants. So what do we see with this? So what we see is that if a preference is given to the patient, if a preference is given to the patient, if the choice is given to the patient on the implant material, many patients would prefer ceramic instead of metal. So this was a survey done by a very renowned implant company, and this is what the patient demand is increasing. Now, next is coming on to the introduction of zirconia. So zirconia was referred to as the analog of steel by Garvey et al. And then there are two types of zirconia. The first one is the yttrium stabilized zirconia, and the second one is the ATZ, aluminum toughened zirconia. So YTZP is far the most successful version which is used in dentistry and is the best combination of toughness and strength. But apart from YTZP, we have ATZ as well, which is used in the zirconia industry for dental implants. Coming on to the periodic table, if we'll check the periodic table, we'll see that the zirconium, which lies just below the titanium. Now, most of you must be thinking that zirconia is a metal, but let me tell you, zirconium is a metal. Zirconia is an oxide of metal. And again, when you see the properties of zirconium and ceramic, they are totally different. If you see the metal, which is a good thermal conductor, YTZP is a insulator. So the properties of metal and the property of ceramic is entirely opposite to each other. So now when the properties are different, you cannot say that this is same metal, same material. So now the properties are different. That is why this is termed as a non-metal ceramics. Even the structure inside is different. Now, this is not only I'm saying. If you see and go and research more and more, you will see many scientists like Floyd Larson. They have also said and explained it very beautiful in this slide, and you can go and read about it. Now, again, if you see the properties between the titanium and zirconia, the density is somewhat like higher. The zirconia is slightly higher than that of titanium. The hardness again is 4 times more. The strength is again 2 times more, and modulus of velocity actually is something which is more, but it is not good to have more modulus of velocity because this lead to lack of flexibility in the material. I'll explain more about this in my next slides. So now when we talk about the scientific literature available, if you see the last 5 years, you will get abundant of literature which talk about not only the osseointegration, which talk about the soft tissue, as well as talk about the biomechanical properties. So these are few of the articles which were in 2017, 18. If you'll see, you will get a lot in 2020 as well. Now, coming on to the history of ceramic implants. So, as far as zirconia is concerned, zirconia has been in the industry since decade. It came, it gone, it came, it gone, and many of the implant companies, zirconia implant companies, they got shut down. So why it took so long for these implants to come in the market? So now if we see that there are more than 20 zirconia implant company present at this time, and more people are opting for zirconia implants. If you see Europe, you have more than 10% of people, like out of total 100% implant patient, are opting for zirconia. If you see US, again, more than 5% are opting for these zirconia implants. So the trend is changing. The patients are looking for more biocompatible and a more kind of white material for their replacement. So why it took so long for these zirconia implants to come in the market? If we see the history, the first zirconia implants came in 1968, and then first commercially available zirconia implant was in 2003 or 2004. So since then, there has been a lot of evolution happening, and there are companies now, they are providing bone level as well as two-piece zirconia implant, which you can use even like angulated abutments. So there are a lot of solutions, and even I have used zirconia implant for full arch cases as well, which I'm going to show you at the end of this lecture. So as far as zirconia is concerned, there has been a lot of changes, and why it took so much time and so much of years. That reason is the zirconia is hard to treat. The zirconia is a very special material, and it is really very hard to treat the zirconia. So I was talking to one of my friends in Europe, and he was working with the zirconia implant, and he was trying to etch the surface. He was working on the surface of these implant, and he was trying to treat it with the acid. So now with the highest concentration of certain acid, he was not able to make the surface rough. So it is so difficult to treat the zirconia as compared to titanium. So that is the reason big companies like Straumann, Nobel Biocare, Coho, and many other, they are Xeramax, they are all working since many years, maybe more than 2 decades, to work to come up with these implants. Now you have the major implant companies with zirconia implant. You have Straumann, you have Nobel, you have Ergon, you have Coho, you have many more, around 20 I can count, and I can give you 20 more companies of zirconia implant at present. TAV. So this is the reason. So if you look into the evolution in implant dentistry, the first implant which you can see is the metal, which came in around 1980s. And then the first zirconia abutment, it came in 2004. I remember the people started using zirconia abutment for the aesthetics. And then came the first monoblock fully zirconia implant, full zirconia implant in the year 2003, 2004. And then the evolution started. We had two-piece implant with cement retain abutment, followed by tissue level external hex abutments, and now we have even the XT, the bone level implants in the market as well. So this is how the evolution is happening, and we have almost like 80% of the solution as compared to the titanium implants. Now, there are many studies. If you see in the last 5 years, especially, you will get many studies on the clinical survival of these zirconia implants. But the only problem now is the data. The data is only present for maybe 3, 4, or 5 years. So the long-term studies are lacking, but definitely there are 1, 3, and 5 year short-term clinical study present, and which suggests that the osseointegration, the soft tissue, the hard tissue is comparable. There are certain things like soft tissue which are even better than titanium. I'll be explaining you more about this in my further slides. So now, what is the transformation process? The actual material we are using is white EZP. Okay. Now the white EZP is yttrium stabilized zirconia, and we mix it with a small amount of aluminum oxide, which is around 5% or 4%, along with the yttrium oxide. So yttrium oxide helps in the aging resistance, and aluminum oxide give more flexural strength to the material. And then there's a process called as isostatic process, and we compact and sinter it to form the tetragonal crystal structure. So the tetragonal crystal structure is the actual form of zirconia which are using for these zirconia implants. So the tetragonal crystal structure, which is the hip structure, is used for the production of most of these zirconia implants. There is one more material, ATZ, aluminium toughened zirconia, which has more amount of aluminum oxide. That is also, but those are only a couple of companies which are using that as a material for zirconia. So I'm just picking it up for the major implant companies which are using yttrium, yttrium dioxide. Zirconium. This white EZP, yttrium stabilized. Now, coming on to the manufacturing techniques. So these implants can be manufactured by machining process, like how we manufacture the titanium implants. Now, another one technique apart from that is injection molding technique, where you have a mold, and uh, then you, with the help of the mold, you shape these implants according to the size and surface, whatever you want. And then now recently, like since last one or couple of years, even there is a process called as printing. Where you can print the zirconia crowns. There are companies which I know which are working with me, where you can even print these zirconia implants. Not only these implants, everyday zirconia crowns which you are placing, you'll be surprised to see. If anybody wants to see how we can print these zirconia implants, I can explain that as well, but that is again a different topic. So uh, now, in all these things, the manufacturing process, we need to understand the transformation, which is very important. So the phase transformation is something like, there are two phases. One is the tetragonal structure, and the other one is the monoclinic structure. The tetragonal structure is a stable structure of zirconia. That is a form in which we use these zirconia implants. But if any process, or if any kind of more trimming with a coarse burr or any kind of thing is applied on the zirconia implant, that can lead to something called as uh, transformation of the stable structure, that is tetragonal, into the monoclinic structure. And this is not good. And this is what we call it the LED, the low temperature degradation of zirconia. So I'll be talking about this as well in my further slides. Now, since I was talking about the phase transformation, so if you trim these, like certain implants like the monoblock implants, you need to trim the abutment based on the height and based on the position of the implant. So even if you want, you can trim these abutments, but only with the help of fine diamond burrs, not with coarse burrs. So if you lead to grinding of these implant abutment with the coarse burr, this can lead to some kind of cracks on the outer surface of the zirconia. So also, what happens when you use coarse burr or something, there will be a transformation of this tetragonal, that is the stable structure, into the monoclinic structure, which is not the stable structure of zirconia. Now, as I said earlier in my slide, that it is very difficult to treat the zirconia, and definitely, but there are a lot of labs which are working specifically on the zirconia surface. And one of the labs is, I know, is UCLA, and there one professor, Dr. Ugawa, he knows me very well, and they are also working on the surface. And there are various techniques by which we can actually do the surfacing of these implants. One is sandblasting, then etching, polishing, laser, UV light, coating, photo functionalization. But what he found out, that there is a special technique where he did the laser surfacing, and he could get a hierarchical surface, which is an amazing surface. And what he found out in his studies was that he could get more and more osseointegration as compared to titanium. In his, see, the maximum, if an implant is there, if a titanium implant is there, the maximum amount of bone which can form around the implant is around 65 to 70%. But in this study, he could found that the amount of bone formation was up to 87%. Can you believe that? So now what I mean to say is that the things are advancing. There are a lot and lot studies which are coming, and there'll be time when you will see that the osseointegration of these implants will be much better with time. So further to this, now what I have done, this is a classification which I have given, and I have divided these companies into a minimally rough, moderately rough, and rough surface of the zirconia implant. So as I said, there are more than 20 companies. You can see many of them are here, almost like 18 companies are here, which are on this slide. So I have divided them based on the roughness of these implants. Now, usually in titanium, what we see is that the roughness lies between 1 and 2 microns. But here, you cannot, as I'm saying, that you cannot compare these implants with titanium. The roughness here is very different. It starts with 0.73 and it goes up to 7 also. So a variable amount of roughness is found in zirconia implants as compared to titanium, where it is only between 1 and 2. So again, if you see in this aspect also, there are a lot of difference. So the difference is in surface treatment, difference is in the surface roughness. And again, in my further slide, you will see there are a lot of difference in other properties, in the biomechanical properties also. So uh, coming on to again onto the zirconia aging, as I said, the stable structure, which is the tetragonal structure, is changing into the monoclinic structure. But there are certain studies, like around a few I saw recently. According to those studies, it was seen, the clinical in vivo in vitro studies, it was seen that this aging doesn't have any long-term effect on these implants, and the aging which happens is very negligible. It's not affecting the stability or the clinical fracture strength of the zirconia implants. So these are a couple of studies. I think 3 of them are here, but you can find more of them. If you see the literature and all, you can see that there are a lot of studies done regarding the artificial aging as well when compared to these zirconia implants. Now, most of you must be thinking, oh, zirconia implant, they fracture. But my friend, just go and see the recent literature, which is in 2018 by Rolling, my friend. So he found it out that the presently evaluated fracture value, which is 0.2%, I guess, is same as that of titanium. So the fracture thing is same as that of titanium. It doesn't mean that zirconia implant they fracture more. There are certain indications. Definitely, these implants are very sensitive. Now, there are protocols. There are protocol. You cannot just follow the titanium rules over here. So there are protocols which you need to follow. Exact torque which you have to use. Again, there is a technique where you have to place these implant as straight as possible. I'll be telling you in my next slide about that. So all these things are there. Let me just tell you one more study by Gellert, which was done in 2012. Now, according to that study, the implant size of less than 3.3 can fracture. So most of the implant company, if you'll see, the sizes of these implant comes with a diameter of more than 3.3. Most of them will use 3.6 as a minimum diameter. Some of them, recently Zeramex came up with a very fine diameter of around 3.3 mm as well. So there are various options coming up now. Now again, coming on to my next slide, which is on finite element study. Now again, it opens a lot of new things with these studies. Now in this study, there was relation. It was studied about the bone and the implant, the biomechanics of the bone when the zirconia implant is placed. So in this study, what they have seen is that the entire pattern of distribution of forces is different. Zirconia implant showed lower stress in cortical bone as compared to titanium, where titanium implant are showing more stress to the cortical bone. Yeah, more to the cortical bone. Along with that, other things are find it out, and where they saw that the zirconium dioxide implant led to lower peri-implant stresses than titanium implant. These are very good studies. One of them, I think, is by Mr. Sridhar. Uh, yeah. So this is on the biomechanical aspect. Coming on to the accuracy and precision while placing zirconia implant. Now, as I said, these implants are very sensitive, and you need to place them exactly straight. Because see why? Because I'm using mostly monoblock zirconia implants, and when I place them, I make sure that I should not trim more. I may need, see, you have to adjust the abutment of these zirconia implants. Now, I make sure that I place these implants in such a way that, and I use a lot of digital dentistry as well, where I place the implant in such a way that I don't have to modify the abutment part of these implants. So when I'm not touching the implant, when I'm not modifying it, means I'm not giving any kind of stress on the abutment part of these implant. Though there are a lot of studies which says that, I'll show you the studies after this, that even after cyclic loading, a lot of cyclic loading and trimming of these zirconia implant has been found, there are no changes, no problems with the flexural strength of these implant materials. So this is one of the studies which is going on in the University of Stockholm. And in this study, see, if you see, there are three pictures. So the first picture, the implant is placed straight. The second one, implant is placed angulated buccally. And in the third one, it is placed more mesially or distally. So now if you see the amount of forces, in the first picture, you see 298. So the amount of forces on the implant are gradually increasing when you are tilting the implant mesiobuccally, mesiodistally or buccolingually. So the amount of forces are almost 3 times more than that of the straight implant. So why to tilt the implants when you can place them straight? So that is the reason I use a lot of digital dentistry, and I make sure that my implants are always straight. It's not about placing the implant, restoring it. It's all about the long-term predictability of these implants. Now, with this, uh, it's not only according to me, but if you see the ITI consensus as well, even they tell it many times. They have told that the implant should be positioned axially, as much as possible. It should be placed axially. Only in if indication exists, the posterior implant can be intentionally tilted. But most of the time, we have to take care that we place these implant axially, parallel to each other. Now, I'll be explaining you one by one the reason why should we use a cornea implant, supported by a lot of clinical studies. And after these 11 reasons, I'll make the session slight interesting by showing some of my cases from single tooth to even full arch. Now, the first reason being always the outstanding aesthetics. The beautiful white color of the zirconia looks natural and does not seen through the gum tissue. So as you know, since the implant is white in color, if there is a thin gingival biotype, definitely you will see that the titanium abutment would be visible, or it will give a grayish appearance. But here, if it is in white in color, it will not show such kind of thing. Again, there were studies done on this, and the study was discoloration of peri-implant mucosa caused by zirconia and titanium, and it was seen that the placement of zirconia implant lead to significantly less mucosal discoloration than titanium. So every point of mine is supported by some of the studies here. Okay, so the next is, again, this is just a picture to show you, like in the thin gingival biotype, you can easily see the grayish hue of the titanium implant. Whereas if it is a zirconia implant, since it is white in color, it is totally very natural and aesthetic. The second reason is allergies and sensitivities. Definitely the allergies to, at the present era, the allergies to these materials, the titanium and its other material is increasing day by day. If you see even the implants, the titanium implants, there are a lot of impurities. That is why my dear friend Dirk, he has also come up with a foundation which checks the cleanliness of the surface of these implants. So if you see the surface, I have been dealing with this, and I'm seeing a lot of impurities on these in these implants. There's a lot of nickel, which people are sensitive to. There are other material, other organic and inorganic material with which people are sensitive. Titanium itself, around 0.6 percentage of patients are allergic to. So I'll show you some studies here as well. So if you see this study, here you will see that the patient develop, after placing the implants, patient develop the rashes, and again prevalence of this titanium allergy is around 0.6%. And the significance of titanium as a cause of allergy reaction patient with remains unproven. But yes, it has been seen in many patients that patients with titanium implants also develop allergies, not only because of titanium, but yes, there are other impurities like nickel and other impurities as well. Now, again, there are other studies which says that the by Fretworth, again, it is a very good study where he talked about the release of titanium particle into the surrounding tissue and lymph nodes. We have also come in 2019, around I think a year back, we have come with a very beautiful study. I forget to quote it here. It's a very beautiful study on the metal particle ion release in the body and how it can affect our body. So that is why I'm telling you that the patient preference is changing. They're looking for a more biocompatible option than titanium. Now, again, if you see this study, here you will see that the acidic environment in the oral cavity can lead to increased bacterial adhesion on these titanium implant, and which can lead to corrosion with dissolution of metal ion. Again, this is a study done by Sridhar et al. In 2015. Now, the next is the strength. Definitely, the zirconia show superior biomechanical properties, and I've already shown you a lot of properties and tests. Here is one more where they have shown that neither cyclic loading in an aqueous environment nor modification of the abutment has any negative effect on the alumina reinforced zirconia implants. Again, this is the other study on the effect of abutment preparation and fatigue, but they found out that the abutment preparation in one piece zirconia implant is clinically safe and acceptable. Now, coming on to the osseointegration, if you look into the osseointegration, osseointegration, you have a lot of studies. If you go and find out the literature, you will see a lot of studies are there on osseointegration, especially in these 3-4 years. And there is no problem with osseointegration. Most of the studies, they suggest that the osseointegration of zirconia is as good as titanium. And you can see here as well that in this study by Stradinger, you can see the unloaded zirconia and titanium implants osseointegrate comparably. This is again another study by Manzano et al. In 2014. Here again, there is no significant difference between the titanium and zirconia when it comes to osseointegration. This is another study of zirconia in presence of, this is I think by I think from ITI, and again here you will see that titanium, YDZP and ATZ, which is the two of zirconia, all of them they show good osseointegration. So again, this is a very beautiful study on the crystal bone response to loaded zirconia and titanium. Here it was, this is done by I think Stephen Rowling, yes. And the conclusion here again, it was zirconia implant with a great increase of distance. That is, DIB means the distance between the implant shoulder and the crystal bone during early healing and function than titanium. So there is increase, more stable bone at the crest. You know why? The reason why there is more stable crestal bone, that is because the amount of stress on the crestal bone is less as compared to the titanium. I told you that study before. Now again, biocompatible. So again, the biocompatibility of zirconia is much more than that of titanium, and again, it is an FDA approved and considered safe. And there are a lot of studies again to support it. And then again, definitely the low plaque affinity. The affinity of plaque towards zirconia is like very less, in the sense, uh, if you see titanium and zirconia, the soft tissue, it just loves zirconia. It just form a nice collar around zirconia, and It's just form a nice addition. Whereas in titanium, you will see a lot of plaque adhering to the titanium surface. And this has been again scientifically proven in a lot of studies, not one and two. This has been not a problem at all. There are a lot of studies in vitro biofilm formation on these titanium and zirconia implant surfaces. And it has been seen that the zirconia implant surface showed a statistically significant reduction in biofilm formation compared with the titanium. Not one, again, there is more. And then in this study, it was seen by Linares that there is no difference in osseointegration. Osseointegration remained the same, but compared to titanium, the ceramic implant showed a more mature and pronounced soft tissue integration. So as I said, the soft tissue integration is much better than that of titanium. Again, one more study on the soft tissue and the inflammatory infiltrate, and you can see here that the tissue around titanium healing caps underwent a higher rate of inflammation associated process compared to zirconia. So more inflammation when it is titanium as compared to zirconia. Again, health conscious patient, as I said, if you see the trend of zirconia implants in the world now, as I said, more than 10% of the patients, they have started using zirconia. The patient demand is increasing. Patients are asking for zirconia implants. And similarly in US also it is increasing. In Asia it is slightly less, but yes, I'm sure that with time there'll be more and more demand. uh, Price is one of the factors, but yes, I can tell you more about, we can discuss more about this in our Q&A. Again, scientifically proven. If you see, as I said, in Europe it is being used since 1980s, in US since 2007. And again, a lot of studies by Spies and with a 1-year follow-up. So this is again just to show a few of the studies with 89% at 1 year and excellent clinical stability. No titanium and release. We have a beautiful article as well published last year. So again, if you see a lot of literature in 2018 to 2020, you will find a lot of around maybe 10 articles, especially on this titanium ion release of these ions in the harsh environment, in the fluoride environment, in the acidic environment. And this can lead to other problems. When more and more ions, this can lead to peri-implantitis. So here you will see, I will share a few articles as well. If you see here, it's a very beautiful picture. You see one of the right hand side, you can see one implant is being removed from the ceramic implant being removed from the socket, and in the other you can see the titanium implant is being removed from the socket. You can see in both the pictures, you can see in the titanium there are particles of titanium which are there on the bone, as well as you can see the clean surface, how clean it is when the ceramic implant is removed. So this is what I was talking about. See, this is our paper which came, I think, in 2019. Yes, 2019, and there are a lot of rates on these on this particular paper. You can, if you want, I think this paper is open, and you can, all of you can download this and you can read it once. If you're not getting it, even I can mail you that. This is another paper regarding the drills. I also use a lot of zirconia drills in my practice because of, you must have seen, try to observe when you sterilize and don't clean the drills and all, you will start seeing yellowish patches on the drills and all. That is the rust, that is corrosion. So to avoid that, see, you are using those drills again in the socket. So avoid that. I use a lot of zirconia drills. They are more sharper, they are more efficient. Yes, definitely the cost is one factor, but they are proving a lot of things when we consider the patient health. Again, these are closer to nature. The white color is always the nice color, and again, the soft tissue very well adapt to the white surface. The plaque retention is less. So you can see in this picture only how the white color is matching with the pink, and how the gum is has formed a collar around these implants. There is more. Also, there are studies. I think many studies on the collar of these gums around the zirconia implant, what they have seen, the amount of capillaries, the blood vessels, the supply, the nourishment is more in the gums around the zirconia implant as compared to the titanium one. So there are certain limitation definitely when you use monoblock implants. uh, you have to be very careful. As I said, these implants are very sensitive. You don't have to trim them very too much, and you have to place them precisely. Again, abutment height, and now if it is an immediate implant case, you have to take care how to preserve it. But now these are the limitation of monoblock implant, but definitely if this kind of situation comes, you have the option of two-piece implants as well. Two-piece implants are new in the market in the sense 2016 onwards, but definitely I think there are my friends who are using them from last 3-4 years, and they have found very good results. But still I am more focused. I mostly place monoblock implants, and I have special tricks and my protocols when I place these implants. So one of the as I said, one of the tricks is always to place them straight and parallel. So I have various kits where I try my best not to trim the abutment part of these implants too much. So these are the other limitation, that cementation, peri-implantitis because of the excess cement and all those things. But again, there are tricks and tips where you can avoid the extra cement. Again, there is again a different topic when it comes to the cementation of zirconia implant, zirconia crown on zirconia abutment. So which type of cement, how to treat it, and how much to use it. So all these questions are there, and a lot of things are there. Again, it will take a lot of time, and maybe in my next lecture I can discuss more about these aspects as well. Now, two-piece zirconia implant in 2000, I think there was cement retain a few years back. Maybe in 2000, after 2010, there was cement retain abutments, but now we have even the screw retain abutments. So, and that too, we have angulated abutments. We have titanium screw inside the compartment. We have the peak screw. If patient doesn't want screw, also we have a solution where we have peak screws as well. And uh, we have almost all the solutions which we have in titanium. But yes, there are few more things which are remaining, which will complete the armamentarium of the zirconia implants. So again, limitation, as I said, one piece monoblock, you have to take care. You have to uh, you need to know like what are the replacement, the temporary replacement solutions for these implants. Again, what I do is let me tell you about some more important things. When I give the crowns for these patients, I use peak based crowns as well. Again, peak is something which absorb the modulus of velocity of peak is less, around 4, which is very less, and it absorb all the forces. So again, the amount of forces going on to the implants are very less. Again, this is a huge topic, and we need to discuss more. But yes, I give a lot of peak restorations for my zirconia implants as well. Now, two-piece, again, as I said, there are studies for two-piece zirconia implants as well, and there is a success rate of around 87% after the loading process. Again, systemic reviews are there. Hello, Ruben, how much time is left for me? 5 minutes? Okay, I'll just try to cover up. So let me show you a few of my cases. I'll skip these slides. Uh, so there was more to show about the 3D printing and all, but I think we are running short of time. So I'll quickly come to the cases. So clinical cases from conventional to partial. So this was a root canal fracture. You can clearly see in the X-ray. And then I placed the zirconia implant, and you can appreciate the crown fixed. You cannot make out anything. It looks so natural. This was done around 4.5 years back. So I have a follow-up of 4.5 years for this case. And this case was also published in the OMS magazine in Germany, and was appreciated as well. This is another case of molar where the crown was replaced, and then you can see you can appreciate the arrow is marked where you can appreciate how the gums they have formed a papillary collar around these implants. You see how healthy it is. There's another case where I have bypassed the implant through the cyst and I have given the crown. And this is another case with periapical cyst. Patient wanted to extract the tooth, place the implant immediately, and then cementation was done. So again, you can appreciate the gingiva, you can appreciate the papilla which is formed around these implants. So again, this is a peak-based crown which I was talking about. This is again immediate. There was a failed RCT. I removed the tooth and I put this implant, again monoblock implant, and see again the papilla. So most important thing is papilla. You see you will appreciate the papillary collar around these implants. So again, I did this crown digitally. As I said, I use a digital process for restoring as well as for placement. And again, this case was published in the Journal of Clinical Practical Oral Implantology, Part 1. And you can appreciate here again the collar of the gum collar and as well as the crown. Now these are a lot of cases where I have done one side titanium, one side uh, zirconia. So you can appreciate in all the cases you can see how the papilla has formed around these implants. So nice, so good. So these are okay. Coming on to the digital one, this was the case with the Bredent, and the implant was placed, and you can appreciate again here the papilla, how the papilla is formed here. So my main concern, see, this is again another case where I have done it complete digitally with the help of Twingus guide. This is a different kind of metal free guide. So again, the guide here also is metal free, and the sockets, the pellets are made out of, means everything is made out of resin. So I'm not using metal at all. So it is again guided surgery, and you can see the placement of implant and how the implant was placed. You can see, appreciate the soft tissue, and then the crown, the temporary crown was given, and this was the final. So I wanted to show you this X-ray, how stable is the bone. You can see and appreciate the bone, the crystal bone around this implant, as well as you can see how the osseointegration process happened. It looks so beautiful and so nice here. Again, this case was also published in the OMS German magazine, and this was another case. In this case, I did one side with zirconia, other side with titanium. I just wanted to see the result. And in this case also, you can see one side I placed titanium, one side I placed zirconia. This was for the titanium. And let me move. Yes. So now you can appreciate the X-ray OPG. One side is zirconia and one side is titanium. So I restored the crowns with the okay, the picture is not here, but it is being restored and it is doing well. So this is what I was comparing, one side with titanium and one side of zirconia. The next case is again a full arch case. Here I utilized just 4 implants, and I was able to give a full arch to the patient. Here you can see the problem, like the the infection, and then I cleared everything. These are the few X-ray which gave me inspiration to do full mouth. And then I picked up this case. I've placed 4 implants. I took overall intraoral scan. The scanning was done, and then this is how my final picture. So I have to trim the anterior implants, but this is how it looks like, 4 beautiful implants. And I gave the temporary processes. Then the final restoration was designed, and even the final restoration was given like this. It was like this. So again, I have one more case to show. Then I am doing the lower arch also. So it is in progress. Now this is the second case. Again, this I place a full arch. I place 6 implants on top, and these are the X-rays. And this is like a kind of CAD-CAM abutments which are prepared to correct the position. So rather than trimming the abutment, we are shaping these CAD-CAM abutments and giving on the implants. And then this is how it looks. See how beautiful it looks when it comes to the zirconia implant. See the soft tissue. And then this is how the temporary was given, and this is the final restoration, and this is how it looks. So beautiful, so nice. Everything is zirconia. There's no metal at all in the mouth. Again, this is the smiling last picture. This is a video I wanted to show, but I think we are lacking in the time, but this is a case which was the video. This case again is published in the magazine. You can see how I extracted the tooth and placed the implant immediately and then restored it within a day, and patient walks out with the implant in the crown. So in the conclusion, what I would like to say is that titanium is far ahead than zirconia, definitely, no problem. But there has been no significant improvement when it comes to the surface or any kind of other thing in the last 30 years. Everything is just in titanium is revolving here and there. And there has been no improvement in any surface. Surface remains the same. But what I'm trying to tell you is that in zirconia, there is a lot of possibilities. Every time when you see, there are chances that we can improve this surface. And with time, I'm sure that we'll be able to have a surface which will give even more better osseointegration and even better surface and many other better things when compared to titanium implants. And definitely the digital dentistry is an important aspect of zirconia implantology, because zirconia implants are very sensitive and we need to place them straight. So with this, I would like to thank you, all of you, for listening to me. And uh, thank you, Ruben. We can have the question and answers round if we are left with the time. So this is one more implantology, the implant industry course we are running in the University of Jaume, Spain. So any of you who is interested to join this course, you can do it from India or any other country. You need to visit to the university maybe a couple of times, and you can have a Messi degree for this course. So any of you, if you are interested, just let me know, and we can have the admissions are starting from October this year, and this will be a 2-year course.
What are the contraindications of zirconia implants?
Okay, as such, see, there are no contraindication when the osseointegration of zirconia implant is as comparable to the titanium implants. But what I would say is, wherever there is an too much angulation, like, you have to avoid the angulations. 10 degree, 15 degree is okay, but wherever it is more than 15 degree, you cannot angulate these implants, because it will be difficult for you to trim it. And that too, in two-piece implants, you don't have abutments more than 15 degrees. So maybe you cannot place these implant in situations where a lot of tilt is required, definitely. Apart from this, I think in medically compromised patients, definitely you cannot think of these implants, because again, the literature is not there. Maybe it would be a success, but I will not recommend you to do this. And the third thing is, for full arch implants, it is don't try. I had done a couple of cases, because again, I'm doing a lot of research and all, but this has been not proved till yet that you can do full arch cases on these zirconia monoblock or two-piece implants. So for single implants or for bridges, you can use the zirconia implant, but not for full arch cases, not for a lot of tilting, and definitely not zygomatic. It's not, means nothing has been done. But yes, we are working on it, and I'm sure that in coming years we'll have these solutions as well.
Thank you so much, sir. Before we move to the next question, let's try to understand what kind of medically compromised patients. Does it come under the diabetes category or everyone, right? From
Yes, I mean to say, see, the thing is, whatever we have tried and whatever papers we have seen, it's all about uh, the healthy patients, okay? Not the patients who are chronic smokers or diabetes. These implants may or may not work. So, like for titanium, we have a lot of studies on smokers, diabetic patients, but for zirconias, we still need to wait for all these things. So I think we need to wait for some more time uh, to place these implants in medically compromised patients, because we don't have any studies related to patients where we have done these implants in patients with extreme diabetes or smokers and all those other medically compromised conditions.
Thank you so much, doctor. I'm sorry, we'll have to run a little fast so
No
that.
problem. Yes, yes, yes. Even I'm trying my best.
Yeah, yeah, I understand that, and I know that for you, when it comes to answering, it's answering in full length, but we have to cover it. Move
Yeah.
to the next question. What are the
Yeah.
instances of peri-implantitis as compared to titanium implants in
Okay.
implants?
Okay, this is a very good question, and definitely the amount of peri-implantitis with these implants is very minimal. In my entire career and my colleagues who are placing it from last 10 to 15 years, we have seen a very minimal peri-implantitis when it comes to zirconia implant. It is there, but very minimal. The reason could be because there is no release of any ions or any kind of metal. Again, the soft tissue adherence, again, the gingival coverage, the collar which it forms, all these things are the factors which prevent means any kind of peri-implantitis happening with these zirconia implants. Maybe I have seen what we usually seen is like aseptic loosening. If my implant fails, it becomes loose, but it doesn't leave any infection or inflammation. So we need to have more and more again studies on this. But till now, whatever implant, 15 years, whatever we have seen the results, that the amount of peri-implantitis is very low when compared to titanium implants.
Thank you so much, sir. That was a wonderful answer. We move to the next question. Is zirconia implant indicated in anteriors where we don't want to show metal, example titanium?
Yes, yes, definitely. See, in the thin gingival biotype, where the gingiva is very thin, and in such cases, what can happen is the gingiva, the gray color of the metal, can reflect, and it will not look good. So when the patient has a low smile, means the smile is visible. In that case, what will happen? The gray margins of these implants, titanium implant, could be visible. So definitely, and zirconia implants are meant for anteriors. They are more aesthetically demanded, means in the they are placed more mostly in the more aesthetically demanded areas like anteriors. So yes, they are based for anteriors.
Thank you so much, sir. We move to the next question. A country like India is a price sensitive market. What is the price range or the costing of zirconia implants? How do we compare it to best selling cheaper titanium implants?
Okay, all right. So now, see, I know the price is a concern in Asia. The price is quite high in
Of course,
Europe and
India as well.
US, but you know that there are many other companies which are coming, so the competition is increasing, and the price definitely is going to go down. There are companies like Strawman and Noble which are selling it for a slightly higher price, but I'm sure that there are other companies also coming up, and many of them I know as well. I don't want to disclose the name, but definitely the implant would be much cheaper. Maybe you can say around 10 to 12,000 per implant. Means
Wow.
where it is now, it is like more than 20,000. In later further, like when these companies further they will launch their implant, you will be able to use means for cheaper price also. So
So the
uh,
future of zirconia implants will be
it's
at par
bright.
when it comes to titanium implants.
Yes, it's bright. It's bright,
And
definitely bright.
when you say implants, does it include the healing cap, the abutment, or just the implants, sir?
See, when you are using a monoblock, yeah, see, that's what that's what the thing is. When you use a titanium implant, you have a lot of components in it. You have this and that and many things. Now, when you use a zirconia implant, for example, I buy a implant, I place it in my implant, I place it in my patient. Now, I don't need any abutment. It's a monoblock implant with the abutment. Now, I don't need anything else. I just what I do is I just scan it directly. Again, since the surface of the zirconia is non-reflecting, you can directly scan the abutment without any scan body also, though there are scan body for accuracy if the implants are deep or something. But for me, I have scanned most of my cases directly, so I don't need any healing abutment. Sorry, I don't need any healing abutment in case of monoblock implants. I don't need any kind of impression copings or anything. But yes, for two piece it is required, but monoblock implants, you are saving a lot of time and a lot of money.
Thank you so much, sir. Next question. Immediate loading. Is it possible with zirconia implants?
Yes, again, it depends upon the type of area. If it is interior, definitely you can load it immediately as well based on the torque values and based on the ISQ values. But for posterior, I would say immediate loading is not a good option as of now. So because again we need more and more studies on this, but it is always safe to restore it after a time period of around 3 to 4 months for 3 to 4 to 6 months for maxilla, and 3 to 4 months for mandible.
All right. We
The
move to
period remains the same like titanium.
all right, sir. Sorry. We move to the next question. Monoblock tie implants. Trimming done as stated. Any inherent risks?
Hmm?
monoblock implants, you've spoken about trimming.
Okay, trimming. Okay, all right. See, as I said,
With
yes,
trimming.
yes, yeah. As I said, when you trim the implants, you are changing the. See, again, if you are trimming the implant, I would recommend you to use the fine diamond burr to trim the zirconia. Okay, if you are using a coarse burr, there are chances to develop micro cracks on the surface. That indicates that the stable structure, which is the tetragonal structure, is transforming into the monoclinic structure. So as I said, these implants are very sensitive. You can trim it, but use a fine diamond trimming burr, use minimal trimming, and don't use any coarse burr. Don't tilt them too much. Use lot of options. Digital dentistry is there, everything is there. You can place these implants straight to avoid all these kind of trimmings. But yes, trimming can be done, and there are studies which have shown that trimming will not lead to any problems.
Thank you, sir. Should be the last question. What
Hmm.
cement do you use for zirconia implants?
Now, since I am using the zirconia abutment and zirconia crown, so for me, I have compared a lot of cement, and I have seen that the resin cement, the the resin cement works well, like with the bisco primer uh, and the cement. Resin cement is quite good for zirconia to zirconia bonding as compared to any other cement.
All right, doctor. Before we move to the next question, I think that's the end. Very common question is, I'm very interested for the course, sir. Can you please give me more details? Can you please share your email ID? So,
Sure.
yeah,
Yes, definitely. If anyone is interested, you mean to say, shall I give my email ID?
you can tell to me and I can type it for you, sir.
Okay, Saurabh, my name,
Yes, sir.
dot RAVZZ
RAVZZ
at gmail.com.
at gmail.com.
So anyone is interested can let me know. I can share the brochure for the implant course at the University of Jome. And this is a very great opportunity to get the MSc done from an external university, one of the top 500 universities in the world. And this will also help you to build your clinical practice as well. So anything, just mail me and I'll be able to reply with all the questions and answers.
Yes, ladies and gentlemen, you can get in touch with Dr. Saurabh. You can also get in touch with us, DentistChannel.Online. We can pass on the
Yes, definitely.
just in case Dr. Saurabh's busy. We would be more than happy to help you to reach to
Definitely.
heights and be the future zirconia implantologist, just like Dr. Saurabh. And Dr. Saurabh, once again, a big thank you to you for gracing this event with your presence. We truly felt your presence. You're one of those very passionate, interested doctors, and it's always been a pleasure to be associated with you. We hope and we pray that we are associated with you always and forever. Once again, best wishes to you and to your newly venture and to a lot of successful cases. Thank you so much. Good night and have a good
Thank you.
evening.
Thank you, Ruben. It was a pleasure. Thank you.
Thank you
Thank you
so
very
much.
much.